Hi, hello, good night. I want to say welcome to another reflection video to the new people. If you're watching this, I hope you enjoy it and focused on this reflection on migrant and health readings of this week. And the readings both focus on how migration influences health, but through different conceptual perspective. And the authors Spallek, Zeeb, Razum, and others emphasize that migrant health cannot be understood as a simple comparison between migrants and non-migrants, as instead it requires a dynamic and life course approach that considers exposures before, during, and after migration. So the key concepts are: first one, healthy migrant effects, like migrants are often healthier than the host population when they first arrive, probably because only their strongest or healthiest people manage to migrate. However, this advantage tends to fade over time to the poor living and working conditions, stress, and socioeconomic inequality. So, the second one is migration and health transition. Because migration represents repetition health patterns. For instance, moving from environments where infectious diseases, like we could say to this, dominate to those where chronic diseases like diabetes and heart disease are more common. For example, in Mexico, we have the first one or second or third step place of diabetes, and life course model is the third one because health outcomes are shaped by exposures throughout life, from prenatal development to adulthood. So the model explains how early experiences such as nutrition, infections, or stress can influence diseases decades later. So the authors choose to emphasize these points because traditional studies often overlook the temporal dimension of health. So the idea that it evolves through the time across generations. So understanding this helps explain why certain diseases appear differently among first, second, and even third generation migrants. So the second point of the readings, like all the weeks we say, is: was there anything unclear or confusing to understand of the readings? So one challenging part was understanding how the health migrant effect can coexist with poor living conditions and lower socioeconomic status. So at first, it seems contradictory that migrants may have better health outcomes despite facing more disadvantages. So, disadvantages. Yeah, disadvantages. That's the word that I want to use. So, however, after reflecting, I realized that this paradox is partly explained by selection bias. Healthy people migrate. So in cultural habits that initially protect them, such as stronger family cohesion, better diets, or less alcohol use. Over time, these advantages fade as migrants adapt to the host country's lifestyle, and face chronic distress and limited access to care. Another difficult aspect was distinction between biological nature and environmental nature factors of this, because the readings show how genes, early life conditions, and social environments interact. But it can be hard to separate their specific effects in real life. So understanding this overlapping factor factors is essential for developing fair health policies. That's the phrase. So third one is what was new for me and how did it change my perception? Difficult, but what struck me most was the life course perspective. I think because I had always thought of health as something determined mostly by current lifestyle or healthcare access. But now I see that the person's health and careers, their past, even events before birth, such as maternal nutrition or childhood infections, can affect adult disease risk. This changes the way I think about public health and preventive medicine. Migration is not just a movement between countries. It's a biological and social journey through time. So it helped me understand why second or third generation migrants can have different health patterns, not just because of genetics, but due to accumulated experiences and cultural adaptation. That's a lot. And this idea also connects with other medical fields such as epidemiology and pediatrics, where early life determinants are key to preventing chronic disease later on. And fourth question, is there something that I would like to explore further and why? And the answer is I think so, that I would like to explore mental health in migrant populations more deeply. Because the readings mention stress and adaptation, but it now focus extensively on psychological outcomes. I believe that migration is not only a physical transition, but also an emotional and identity-based experiences. Understanding how trauma, discrimination, and the feeling of being between two cultures affected mental well-being of migration could help healthcare providers offer more empathic and culturally competing care. Because I would also like to learn more about gender differences in migrant health, especially how migrants can both empower and endanger women. Because depending on their social and economic context, we agree about the process of migration. It's not the same for the woman, and the man. Maybe the man feels that they have to work more, and maybe the woman have to be like a help for them. So this is like lead us step for the next question, that give at least one example from my personal or professional life related to the readings. So I get family that they are migrants, or they were for a long time, and the process is hard. Fortunately, they don't have never had problems about the health, but about the mental care is the most important, the adaptive process. So that's why, or that's the reason the mental care or health care is the most important for me. So I met a woman once who had recently migrated from Central America. She was healthy at first, but developed um, developed hypertension within a few years of arriving. So she explaining how her a new job about like hours, little rest, and constant worry about sending money home. That's the how can I say? That's the first worry of the migrant people got send money or provide their families. Um, so this made me realize that her disease was not just medical. It was a result of stress, economic pressure, and social disconnection because when you need attention, you got to have a medical on the other country. For example, if you are in the United States, right? And if you don't have a work with your work visa, it's almost impossible that you gonna get or the best attention in medical, right? So the experiences of the people that they got a disease, they are sick, and they are alone. They don't have anyone. It's feel very real. So it showed me that as a future professional of the medicine, we need to look beyond the symptoms and understand the social and life course background of our patients. So that's the conclusion. Ultimate student migration and health teaches us empathy. It encourages us to see each patient not only as an individual in front of us, as someone carrying an entire life journey, past, present, and future within them. So thank you for watching.